As an EMT, you get a lot of really crazy calls.
We're the first to respond, and things rarely go all according to plan.
1, 2.
All the time we get patients, and I'm like, what are you doing? Are you nuts?
Oh my God.
You hear about stories like this, but you never think you're going to be in one.
The life of an EMT is anything but normal.
No! No! Oh, that's not good.
And these stories are the most unforgettable.
Get it off! Get it off!
The craziest.
It's sometimes very difficult not to laugh at some of the stuff that we get.
And bizarre calls these EMTs have ever experienced.
What is wrong with you, lady?
This is OMG EMT.
Pick up. Hello, I need an ambulance. It's my son. He's not breathing. He's turning blue. He's 3 years old. No, he's not choking. It's something else. Okay, hurry. We'll meet them outside.
Cheers. There's always 2 rules in EMS. Pee when you can, eat when you can. EMS stands for eat more sandwiches.
Rescue 62, Rescue 62.
Rescue 62, go ahead.
Child needs assistance. Mother says he's not breathing. Child 3 years old.
EMS has always been a profession where you have hours of sheer boredom punctuated by a few minutes of, terror.
Copy. What's the location?
We were sitting on post. We get the call for pediatric trouble breathing.
All right, we're on our way.
There's a lot of things that can cause respiratory problems. Asthma. They don't chew up a hot dog well enough, and they don't tell mommy and daddy that they're having trouble breathing because they're scared. They don't want to get in trouble. And one of the problems with pediatric calls is parents are upset. It's a kid. They can become panicky or overly aggressive, but this situation was a little different.
Yes, 911. I need help. There's a problem. I'm on the 3rd floor, and could you please hurry? Thank you.
That day was really hot, just hotter than July. Triple digits, muggy, sweltering, but you got to deal with it the best you can.
Rescue 48, Rescue 48.
Rescue 48, copy.
Elderly woman, age 79, needs transport to hospital.
Copy that.
We get this call on the radio for immediate assistance to transport an older woman from her home to the hospital for a procedure, and she needed to get it done fast. And with older patients, there's always one or more health issues going on, whether it's breathing, respiratory, whether it's blood flow, maybe their heart isn't too good. So one thing could lead to another thing. And this particular situation, we weren't really ready for what was going to happen.
Dude, I say we win by 21 today. Oh.
Dude, at least 21. Tell me about it.
Lady in the white pants. White pants.
Hello there.
Hi there.
Oh, dude, so many steps. Yeah, this should feel like an escalator here.
Bro, hold my beer. I got this.
Dude, you know how fast you're gonna go, bro?
It's totally doable. Just gotta use my arms for balance and my legs for braking.
Yeah, man. You can. Yeah.
Hold still, I can't get the end of it. I've been in EMS for 3 years now, and I got into the field because both my parents were volunteers, and I fell in love with the family aspect of it. Ow! Like a surgeon. Ow, ow.
Rescue 11, Rescue 11. We have a 21-year-old male who needs immediate attention.
Rescue 11 received. We're en route. The day this call came out, it came out over the radio as a laceration. So we were expecting, a cut or something, minor. But you can never assume too much when it comes to an injury, especially with younger patients. They just assume that they're invincible, that they can't get hurt. You see anything up there?
Bunch of people at the top.
The staircase is on the top of this ridiculously steep hill that if you're not careful can be really unforgiving. They're always up near the top, right? So we get all the stuff out of the back of the ambulance and we start trying to trek up these stairs. Guys, what's going on?
My body's pretty bad.
And the whole time, all we can hear is a mixture of cussing and laughing and, dude, it's not funny. It's not funny. It hurts.
Come on!
I need an ambulance. It's my son. He's not breathing. He's turning blue.
A child is having trouble breathing. Paramedic Mark Cohen and his partner are on their way.
Responding to pediatric calls, you get that little extra kick, that little extra boost, because you're like, this is somebody's kid. And, this could be my kid.
All right, what seems to be the problem?
He's turning blue. Okay. Is he going to be okay?
We roll up. There's this woman holding a child right in front of us. And you kind of, you notice the dog and the girl off to the side. As I'm checking the kid, I can hear the wheezing. So I know this is not a choking. This is a medical condition that I can fix with the medications. So now I've got to get to the truck and get this kid going.
How long has he been like this?
About 10 minutes. I don't know, a while.
To get him back to the rig, I want you to get a nebulizer set up and start an epi drip. He's going to be okay. He's going to be okay. I just want to get an IV going, so I'm going to take him back to the ambulance.
Pets in our profession are a danger because they want to defend the family. You're coming into their home, you're a stranger. And when people are upset anyway, and it's a high-stress, high-adrenaline situation, to add a dog or a family pet of any sort into that mix that's barking or distracting to the family members can make things much more difficult for us.
No, pork chop, no!
What's wrong with him?
We're going to take really good care of him, ma'am.
I get the kid, and I turn around, and there's the dog.
Pork chop, stop! Come here. Sit, pork chop!
I've seen aggressive dogs before, and this thing's pissed off.
Pork chop, come here. Pork chop, sit! Pork chop, stop!
Good pork chop. Good pork chop.
Stop!
One of the strangest calls I've been on, it just happened to be a few weeks ago, is we got a call for a child not feeling well. We showed up to a residential house, and we were greeted by a female, which we found out was the mom, who was dressed in nothing but lingerie. And upon an assessment of the child was fine. We then talked to the mom and said, "Why'd you call us?" And she said she was looking for a date with one of the paramedics or firemen and thought the lingerie would help her case out.
Yeah, I'm on the 3rd floor.
A woman is pushed to her limits by a suffering senior, so she calls in for reinforcements.
This shouldn't be a thing. Like, this temperature shouldn't exist on Earth.
But at least the garbage smells nice.
EMTs play a very important role. It's usually we're transporting elderly patients to and from hospital to home, nursing home, rehabilitation centers, etc. Those kind of jobs are the run-of-the-mill kind of calls that we're going to get.
Please, God, let there be an elevator.
And we're looking at this 3 stories of stairs. It's just, we got to take the gurney up there, and we got to bring this lady down from that. Just the stairs alone are going to be bad.
3rd floor. You better grab the front.
Let's do it. We have the gurney. It's made of metal. Everything on there was probably, I'm going to say, 75 pounds.
Pull, dang it.
Yeah. We had jump box underneath.
Stairway's got more twist than fate.
Just pull, dang it.
Oxygen tanks, because we don't know the situation we're going to come, so we have all kinds of stuff.
Perfect.
You know, you just can't take anything for granted, so we have to kind of be ready for anything. And this particular situation, we weren't really ready for what was going to happen.
Hi, ma'am. I understand you're having a little problem today.
Oh, please, come in.
So how can we help you today, ma'am?
Well, it's my mom. She's scheduled for a procedure at the hospital today, but she won't budge. She doesn't want to go. She needs to go, and I can't get her to move.
Is she all right?
She feels all right. She's just, stubborn. Stubborn is actually putting it nicely.
My mom's like that, too.
I really doubt your mom is anything like this.
Who's out there?
She's in that room, and I just want to apologize.
Apologize for what?
Everything. You'll see.
The daughter was apologizing before we even met the mom. So we're thinking, this is not a good thing.
Ma'am?
Rescue 11, we have a 21-year-old male who needs immediate attention.
Rescue 11 received. We're en route.
EMT Samantha Charon and her partner respond to a call about an impalement. Little do they know how sticky the situation really is.
Come on! Come on!
Hi, okay, I'm Sammy. This is Nikki. We're here to help. Can you tell me your name, hon?
I'm stuck.
I can see that, sweetie, but what's your name?
Derek.
Okay, Derek. It's really, really important to try to keep your patient calm, not just because anxiety can cause all sorts of heart-related problems and everything, but because it can send you into shock, which can be really, really dangerous.
He was sliding down here, and then he just stopped.
Stop texting! I can't believe I didn't get a video.
Oh, you're such an idiot. You're an idiot. You're an idiot.
Guys, we please stay focused.
Hey, you're both idiots. Yeah, well, we're not the ones stuck on a pole, dude.
Sometimes it's really great when a patient has a friend on the scene to comfort them. This was not one of those times. All right, so y'all have been drinking a little bit today, huh?
A little.
And where does it hurt the most?
My butt.
All right, well, let me take a look here, okay?
Hey.
Oh, boy.
Come on, please.
For paramedic Mark Cohen and his partner Tim Hicks, what started as a routine call about a child with a respiratory problem
No, pork chop, no!
has turned into a face-off between man and beast.
Small dogs can be protective just like big dogs. If you have a family member who's really distressed about something, and you have a dog who is very empathetic with that person, and just as we would defend our family members, naturally they will defend their family.
Pork chop, stop. Come here. Sit. Sit, pork chop.
I'm holding the kid, and he's going to be fine. But the dog's not happy, so it's one of those, how do you talk a dog down? Especially when I'm thinking I'm like a 16-pound sirloin standing right there in front of him.
Stop, pork chop.
The only thing running through my head at that point is somebody's going to get hurt, and it's probably going to be me.
Pork chop, come here. Pork chop, sit. Pork chop, stop.
Good pork chop. Good pork chop.
Stop.
Oh, my God.
Stop! No!
Oh, my God!
We ask our patients, medical trauma, whatever, to rate their pain, so we kind of have an idea what kind of pain level they're at. 0 being none, 10 the worst you ever had. I've had some patients, kidney stones go, 12, 13, kind of ha. Funny, okay, we understand that. I was probably at 25.
Let go, pork chop, let go.
I heard this sound, and I turned around.
Oh, no!
As I jumped out of the ambulance and started to cross the yard, I noticed there was this small, furry animal attached to the sweet spot.
Get it off! Don't drop the baby!
Well, when I first started EMS, this lady comes in as unknown medical, so we don't know what's gonna happen. And we walk in, she actually seemed fine. We're like, oh, she must have called for a family member. Where's the person you called for? She's like, no, I called for me. Can you guys help me find my cat? So the fire captain starts yelling at her, and as he's yelling at her, then she starts to hyperventilate, and then she becomes a patient. In the middle of all this chaos, now they have a heart monitor on her and this whole 9 yards. In comes this little cat with the tail up and the head up, just kind of laughing at us for looking for him.
911?
A call to transport an elderly woman to the hospital seems routine.
Yeah, I'm on the 3rd floor.
But when Carl King and his partner arrive,
Who's out there?
they discover this transport is anything but ordinary.
Certainly, elderly patients can be tricky if you are not in control of the environment and controlling the situation. You have pure chaos, and chaos is never a good thing.
Ma'am?
So judging by her one-fingered salute to me, I'm thinking this is not going to be an easy thing, but, you know, older people, I get it. I understand. They're nervous, they're anxious, so I'm there to do the best I can with them.
Now get the hell out!
Hello, ma'am. How you doing today?
Mom, these men are here to help you.
Are you feeling all right today? Ma'am, can you hear me? I understand you have a doctor's appointment today. Would you mind if we help get you there?
I don't mean to be rude, but you, cue ball.
I like dealing with a patient who's elderly, who's got quite a bit of kick in them, because you could tell that they're going to be around for a while.
Now get out, and I'm not going to say it again.
Ma'am, you don't have to be rude about it. But you mind if you explain why you don't want us to take you there?
Maybe it's because I think you're ugly. And your friend there's got a face like a catcher's mitt. So why would I want to go anywhere with the two of you?
Mom, please, they're just trying to help.
You're not helping.
She was quick with the quips and the cursing. She really didn't want to have anything to do with us there. She just wanted us to just turn around and go out that door.
Ma'am, I see you have a Foley bag and a catheter. Can you tell me what that's for?
Oh my, you are dense, aren't you? Do you see what's inside the Foley bag? It's urine. Do you know what urine is?
Ma'am, I know what urine is.
Then why are you asking me?
Well, ma'am, we just want to know if you have some type of, like, condition or something like that, you know?
Oh, well, my goodness, you are not only handsome, you're smart, too. Hey, Pauline, I think I finally found your boyfriend.
Oh, Mother.
Get out of my house!
We'll just take a little second.
As much as I would like to pack up my stuff and go and say, see you later, lady, call somebody else, we knew that she had to go to the hospital for a procedure. So we needed to get this situation taken care of quickly, out the door, and get her to the hospital because, you know, she needed to go.
She's meaner than a bag full of rattlesnakes. All right, we're gonna get the gurney. I want you to grab her under the legs. I'll get the arms. All right, we'll do it on the count.
You guys, I can hear everything you're saying. And I'm not going without a fight.
Make sure you get the Foley bag. Go get the gurney right now. Right. Okay, it's gonna be fine, ma'am. We're gonna take you to the hospital. We're just gonna go on a little ride. It's gonna be fine.
Oh, no, you're not.
If somebody doesn't want to go, it's really difficult to get them into the gurney without doing us damage as well as perhaps doing damage to herself.
Okay, ma'am, we're gonna move you on the gurney, all right?
No, no, you're not.
Just get the Foley bag. It's gonna be fine, ma'am, I promise you. It's gonna be really gentle, and then we're gonna go for a nice little ride, all right? Easy peasy, okay? Nothing to worry about.
You really have to be careful with an older patient because, you know, you could dislocate a hip, you know, they could twist the wrong way or whatever, and you don't want to get any broken bones or whatever.
We're just gonna pick you up, and we're just gonna put you on the gurney. I promise, it's gonna be easy.
Oh, yeah.
These men are here to help you.
Ready? 1, 2, 3. Ma'am.
Now get the hell out!
Mom, please, they're just trying to help.
We're gonna do that again.
It's totally doable.
After a morning of partying comes to a sharp and sticky end for one unlucky underclassman. It's up to EMT Samantha Charon and her partner to figure out how to get him off the rail.
Many times if someone's impaled, the policy is to leave it in place because you can do a lot more damage trying to remove it in the field.
All right. So, Derek,
Hey, it's not funny. Not cool, man. Not cool.
Derek, can you tell me what happened, sweetie?
Well, I was sliding down the rail. I would have totally made it if they took care of these things.
I've seen injuries on and around people's rear ends a bunch of times, but I'd never seen an injury quite like this. And the only thing I could think of was, how the hell are we gonna get him out of here? All right, well, unfortunately, we gotta work with what we got, and I'm gonna have to cut your pants off.
What? No. I just got these things worn in just right.
Sorry, sweetie.
I gotta get a picture of this.
Hey, stop.
Say hi to Mom and everybody else you know.
Oh, man, I just wanna go home.
I know, sweetie. We'll get you home soon. It's sometimes very difficult not to laugh at some of the stuff that we get. You just turn your head and try to get it out as fast as you can. But we had to realize, too, it was a pretty serious matter. It actually ended up really, really hurt.
It's not that bad, right?
You'll be okay. We'll get you taken care of, I promise.
It hurts so bad. It hurts so bad.
Nikki, I'm gonna need some gauze.
Careful. I won Best Bud at the Greek Games last year.
I'm just gonna cut up your pants, okay?
Okay.
We're gonna get you out of here as soon as we can, all right? I'm gonna cut across. I'm gonna try real hard not to tug or anything. Oh, boy. Nikki, I think we're gonna have to call the fire department to cut him off this thing. Okay. There's no way.
Cut me off.
Right,
What's that mean?
I'll hold it. Okay. You're good. The reason we couldn't just pull him off the banister is because it's just like an arrow. If you get hit with an arrow and you pull it back through, all it's gonna do is cause more issues. So what we do is we package it and put tape on it and stabilize it, and that way we can transport him to the hospital where he can get more definitive care and they can kind of stitch him up.
Oh, dude, that is sick.
Guys, stop texting!
About as close as I'm gonna get it for right now.
Rescue 11 to dispatch, requesting the assistance of fire. Tell them to bring chainsaws.
I just want to go home.
I know, sweetie. I know you want to go home, but we gotta get you off this banister first. It'll be soon, okay?
And then get that wood out of you.
No, come on, you don't do this.
After all those years in emergency services, I will tell you, the public needs to know, you need to wear undergarments, because not wearing your underwear can get you in trouble. When you are in a car accident, maybe even a minor accident, you have to have your clothing removed for the firefighters and EMTs to be able to treat you, and you're exposed to the world.
While responding to a call, paramedic Mark Cohen has been attacked by a vicious dog.
Oh, my God! Don't drop the baby!
A pooch that's treating an extremely sensitive part of his body like a chew toy.
Get it off!
No. Give him to me. The look on his face was, as you could imagine, somewhat priceless.
Get it off! Get it off!
And I ran over to him, telling him, don't drop the kid. Don't drop the kid. As he is sinking to his knees and the expected pain that would come from a situation like that.
Oh, don't drop the kid. Don't drop the kid. Don't drop the kid. Don't drop the kid.
I'm not going to drop the kid. I probably squeezed the kid a little snugger, not crushed it, but held on to a little tighter so that I didn't drop him.
Oh, my God.
I can't imagine the kind of pain Mark was in at the time, but I will always remember the look on his face as a look of pure determination and at the same time one of sheer panic.
Oh, God. Oh, my God. Are you all right? Oh, my God. Oh, are you?
Oh, God. I got the child into the ambulance and started to do the workup on them. I was trying to get an IV on the child and was having quite a bit of difficulty locating a vein.
Got the epi-drip, can't find a vein, trying again.
Epinephrine's basically adrenaline. It is a very powerful vasoconstrictor. In the case of a severe respiratory distress, it helps to expand the lungs.
Trying to get some epi into him, I just can't find a vein, though.
Mark has quite a few more years on the ambulance than I have, and at that point, I definitely needed his help in treating the child.
Dang it. I can't get the epi-drip in. Nope.
He got me. Oh, he really got me.
I can't run the line. You gotta help. Can't get the epi-drip in.
one grumpy grandma is raining ruin on EMT Carl King's day.
You cue ball.
But will this patient professional be able to tame this savage septuagenarian?
When you're dealing with an elderly patient, it's really important to discern what they're going through. If somebody feels embarrassed or humiliated, they might also tend to turn around and try and embarrass somebody else or even react violently.
Let me out of here.
Oh,
Ma'am.
Floating like a butterfly, stinging like a bee, aren't we?
Watch yourself. You're next.
Even after we got her restrained into the gurney, she never stopped yelling or cursing or swearing.
Listen, little man, I'm not going.
It was just like machine gun. It was just one thing after another, you know, whatever she could to get us to leave her alone.
You did this to me. You.
Mom, stop.
Let me out of here. This is a crime. You're kidnapping me. I'll have you arrested, both of you.
Ma'am, take it easy, please. It'll make it simpler for all of us.
Take it easy. Take it easy. You're kidnapping me. Call the police. Call 911.
Ma'am, we are 911.
With every call, you want to get in, you want to get out, you know, but as we're getting her outside of the apartment, she's yelling and screaming and kicking, and she's creating a ruckus, and now neighbors are hearing what's going on.
Gary, pick it up. Pick it up.
Help me. Help me. They're kidnapping me. They're just taking me away. Help.
And this was just getting worse and worse and worse.
Oh. Help me. Help me.
You know, and I'm just thinking that, is somebody going to call the police on us?
Help me. Please call the police.
It's mainly men who want to be firefighters. So at my company, I sort of treated them like they were my little boys. They sort of feared me a little bit. They knew that I was no nonsense. I wasn't going to back down on anything they said to me. And I believe I earned a lot of respect that way.
When one college reveler found himself quite literally stuck on a staircase, EMT Samantha Charon rushed to the scene.
Dude, that is sick.
We're gonna have to call the fire department to cut him off this thing.
In the field, the only time you would remove something would be if that was the only way to get that person into the back of the unit into the hospital.
Gentlemen, you want to step aside? So what do we got?
This lovely gentleman here is Derek, and Derek thought it'd be really fun to slide down this hair banister, and it probably was until his butt cheek came into contact with this piece of wood here.
There's a banister bid back.
Firefighters are definitely a particular breed. You know, they just have a sense of humor that's absolutely ridiculous and insane, but they knew they had a job to do, so they got the tools they needed to cut him off the banister.
Okay, Derek, how you feeling, buddy?
Not good. I just want to go home.
We're going to help you with that, Derek. Now, I know this might sound like a real kick in the pants, but you got to hold on there for a minute while we cut you out of here. Okay, fire him up, guys.
Firefighters love to do. They decided to make a little show of what was going on and kind of show off a little bit to our patient. And they, you know, might have freaked him out a little more than necessary.
Looks like it broke off.
No way. In the struggle, our patient actually manages to break off this pretty nice sized chunk of wood, and it made it so the firefighters really didn't have to cut him off the banister at all.
Oh, you were gonna cut my leg off with a chainsaw.
No.
What?
Stop. Calm down. Breathe.
What are you guys thinking?
Hey, at this point, our patient is literally going through the stages of grief. So one second he's crying, the next he's, you know, calling for his mom, the next he's cussing us out. It was weird. But you're off the banister.
I'm off the banister.
It's okay.
Yeah, I think we can just take him down from here and carry him down to your rig.
Okay.
Okay. So, is his butt gonna be okay? I mean, is he gonna be able to, like, you know, do his business and all?
With this particular patient, we had to get him on the stretcher and put him on his belly. So, you know, he doesn't have any pressure on his injury because it can cause shock, it can cause your blood pressure to drop, your heart to race. It just causes a whole slew of bad things to happen. Okay, Derek, we're gonna take you down the stairs now and get you to the ambulance, but I need you to stay as still as possible so we can do this really quickly, okay?
Okay.
All right, guys, let's lift him on my count. 1, 2, 3, lift. Trying to get this patient back to our ambulance was a logistical nightmare. How you doing, Derek?
I'm uncomfortable.
It's not completely uncommon for people to get hurt accidentally while being transported to the ambulance. If you drop a stretcher, if you don't tie them down properly, there's a lot of things that can go wrong.
Real pain in the butt, isn't it, Derek?
Whoa, dude! Whoa!
Calm down. Breathe. Breathe. Even with the assistance of a bunch of firemen who are really strong, you've got a 170-pound patient, you know, all of the gear, and you're going down a steep set of stairs. And we had to take it really slow because if we didn't, we knew something was gonna go wrong. It just was a disaster waiting to happen. Okay.
Okay, ma'am, we're gonna move you on the gurney, all right?
It's been said that age mellows the soul. But perhaps that's not true of all souls.
Let me out of here!
A routine call to transport an elderly woman has instead turned EMT Carl King into a sitting duck, just trying to take cover.
You're kidnapping me!
All right, little lady, next stop, Dr. Town.
Idiot.
See, is this so bad, ma'am?
So once we get the patient into the back of the ambulance and we secure the gurney and she can't really go anywhere, I'm thinking this is going to be easier and easier to do it, but...
You messing with the wrong lady.
It's gonna be okay, I promise.
You're not gonna take me. You're not gonna take me.
Okay, ma'am, please. Come on now, you gotta stop that now, ma'am.
With this particular patient and with patients in general, sometimes they really know how to push your buttons, and you just have to stay professional the whole time. And it's very difficult to deal with people who are constantly trying to, you know, and all you're trying to do is help these people.
Stop it, ma'am. You're quite a little firecracker.
Is she at it again?
Yeah.
You want a firecracker? I'll show you a firecracker.
Put it down. Put it down.
Once I chased a psych patient probably a mile from the hospital. She got out of her gown and started running down a major street topless with only shorts. So I felt I had to save her and protect her. I just said, game on. I just ran right after her. I gave her a good chase and then, boom, brought her down.
Yes, 911.
A call for transport gone terribly wrong.
You messing with the wrong lady.
No, ma'am. Put it down.
As Carl King living the EMT nightmare.
No. No, put that down. No. Ma'am, put it down. Put it... No! Come on! No! No! Come on! No! Oh, she got me! She got me, man! Oh, no!
It was the worst feeling I have ever had in my life, and there was not a lot I could do about it.
Oh, the holy bag!
Oh, my God. Oh, that's not good.
Guys, drive already! I'm gonna be sick! Oh, God! Oh, come on! Oh, I can't believe you did that! What is wrong with you, lady? Oh, this is disgusting!
In Rob, buddy.
Drive, just drive!
This is Rescue 48.
Man,
we have an uncooperative and violent elderly female patient. Request police assistance upon arrival.
This towel is too small.
In Rob, buddy, in
come
Rob.
on!
It's just a little pee.
I'm gonna puke. Oh, God, why did you do that?
You know, the cartoons that you see where the doors open and up in the back of the ambulance and the gurney goes flying off into the streets. That's kind of where I was at with this woman. So we get the patient to the hospital, and just, it was bad as it could be. That urine was on my shirt, it was in my hair, it was on my face. You know, I could feel it just dripping down my face, and just all this, the smell, the feel, the odor, and it was just so nasty and disgusting. I mean, it was just filthy.
Well, hello there, miss.
Hello.
We are going to be taking care of you from here on out.
Oh, aren't you the sweetest thing?
They're prepared for some Tasmanian devil in the back of this ambulance, and the woman just does this 180. Sweet, innocent, compliant, gracious. You kidding me?
Oh, I just love your hair.
You're so sweet. Did these men treat you okay?
I mean, this was definitely a case of a wolf in sheep's clothing.
Watch out for this one. She's...
Some people just don't know how to treat a lady.
Ain't that the truth?
You said it.
They did not believe us. This sweet little old lady could possibly do that.
Well, we are going to take good care of you today.
All right.
Let's get you away from this ambulance.
Oh, yeah, that's a good idea.
That was the call of calls, and I have to say that was the worst in my book. This particular call was the Mount Everest of calls.
An emergency call to a suburban home brought paramedic Mark Cohen face to face with every man's worst nightmare. A pooch named Pork Chop.
Don't drop the kid. Don't drop the kid. Don't drop the kid.
The groin, it's a very resilient part of the body, but yet it's very sensitive and delicate all the same. If you take a large blunt force trauma to the groin area, the testicles can become very swollen, almost beyond recognition. So it's very startling when a patient can see that their testicles are the size of 2 basketballs.
Got the epi drip, trying to find a vein. Trying again.
Oh, God. Oh. Sometimes it's quite hard to find a viable vein on a child. The anatomy is the same as an adult, however, it's much smaller and sometimes much more difficult to find.
I can't run the line. You gotta help, can you?
Yeah. Hand me the line. Hand me the line. Yeah. There, it's in. Yeah. I got it. At that point, Mark really stepped up and, you know, rolled over, got the IV, and came through.
If we got another unit coming, I can transport.
All right, I'm gonna let the family know. Oh, God.
Oh. Is everything all right with my baby? What's wrong with my baby?
He's doing really well. We have him stabilized, and I'm really sorry, but could you maybe move that dog away from me? We think it was a severe asthma attack. We are going to take him to the hospital, get him checked out, though.
Thank you. Thank you.
Okay.
Oh, I'm so sorry about that.
Thank you so much, sir. That was such a terrible scare.
Yes, terrifying. Absolutely terrifying.
And I am really sorry about Pork Chop. I just don't know what got into him today. You okay? How is your,
It's going to be okay. Why don't we...
Okay.
The grandmother and the mother both, you know, were apologetic, and they were like, you know, we're so sorry. It's like, just make sure the dog stays in the house, and I'm good. Once the pain receded down to about a 9 or 10, I got back up, shuffled over to the ambulance, checked, make sure things aren't punctured or dislocated or torn off or disappeared. I don't know.
All the equipment still in the right place?
Oh, you gotta be kidding me. There was some swelling and bruising, I will admit to that, and it was painful for a couple of days. But thankfully, I didn't get punctured.
So how many times has this happened before?
Why did it have to be a little dog?
All right, so y'all have been drinking a little bit today, huh?
A little. After a chunk of wood had its way with one college kid's day, emergency rescuers rushed in.
There's a banister bit back.
Now it's off to the hospital to see if doctors can remove what an old wooden staircase left behind.
Alcohol impairs judgment and common sense, and it's very unfortunate because the part of your brain that gets dulled when you're drinking a lot of alcohol is really the part that's supposed to make sure that you protect yourself.
How long is it gonna hurt like this for?
I'm gonna be completely honest with you. You're not gonna be able to sit down for a few weeks. Once we got back to the ambulance, I finally got to ask the one question that was on everyone's mind. So you gotta tell me, did you really think you could make it down that entire banister?
Dude, I had it totally nailed.
Dude,
you know how fast you're gonna go, bro?
it's totally doable. Just gotta use my arms for balance and my legs for braking.
Yeah, man. You can.
Dudes! I'm stuck!
All right, let's go. Our patient did stop by the station a couple weeks later to, thank my partner and I and telling us how he's been. And he goes, I was trying to think of what to say to you guys, It's not really much I can say, though, except for thank y'all for saving my ass.
I just want to go home.